cluster of Covid-19 cases was announced earlier this month, centred, ironically, on a Covid-19 test and trace call centre in Lanarkshire. Now, the issues which exist in these centres have been well documented by Professor Phil Taylor of the University of Strathclyde, who ran a survey in April answered by more than 2,000 call centre workers. A multitude of concerns were raised. On social distancing, workers were often spaced one empty desk apart, but because of the proximity of banks of desks or lack of space surrounding them, 2 metre social distancing was proven impossible when actually moving around the call centre floor. Many workers were also reporting that motivational team huddles were still taking place, with no adherence to social distancing rules. And the same went for one-to-ones with supervisors or with managers. Significant concerns were also raised about sanitisation and cleanliness, for example, of toilets. Almost 3/4 believed management were either ineffective or very ineffective at providing personal hand sanitiser. And there were tales of lack of hand sanitiser on entry to the premises, leading workers to go to the toilets to wash their hands because they were being responsible, but then having to exit via 2 pull-handle doors and return to using what they describe as filthy keyboards which nobody trusts, also while hot desking. And hot desking is itself described as a deep-rooted complaint, with half of those who responded to the survey saying management were very ineffective in making sure that call handlers were able to just use their own workstation. Worryingly, 78% either strongly agreed or agreed that they felt pressured to go into work. Strict target impositions, harsh performance management and appraisal systems, and discipline-focused attendance policies all seem to be to blame. Now, it doesn't take a rocket scientist to realise that this could lead to a scenario where someone who feels unwell will present for work for fear of losing pay or being disciplined. Then there's the issue of working from home. Of the 65% who'd requested to work from home, only around 5% had had their request approved. The vast majority were still awaiting a decision, but already 1/3 had had their request rejected. Reasons being given included technical capability and regulatory issues. Now, we're aware of a number of call centre workers who've been successfully working from home, who have in recent weeks been getting the call or the email from their employer telling them to get back to work within the call centre. Now, that's despite the fact the Scottish Government's own route map stated that the earliest indicative date for non-essential offices and call centres to reopen was the 23rd of July, and that working from home and working flexibly were to remain the default. On the 22nd of July, Nicola Sturgeon announced that non-essential offices and call centres should remain closed, as she said, until we judge it is safe to make this significant change for Scotland. Now, we may get more information on this in the coming days at the update due on the 30th of July. But whatever the decision, on that day it's clear that call centre workers have significant concerns about the safety of their workplaces. And we'd urge anyone with concerns who's looking for some advice and support to contact our Covid-19 helpline on 0800 0015 022 or to drop us an email at info@scottishhazards.org. We'd also be really interested to hear from call centres where staff believe that their employer is getting it right. Sharing good practice is beneficial for everyone. If you're unsure what measures your employer is taking, ask to see their Covid-19 risk assessment. If you're a vulnerable worker, and especially if you're a worker who has been shielding, ask for a personal risk assessment to be undertaken. And subscribe to our YouTube channel for further useful content, because we are determined to help stop this pandemic at work.